here today. Really appreciate it. And Wes, and thank you, Ashley, for putting that in our chat. And just want to remind everybody again of our ADPC Prevention Committee's definition of primary universal prevention, which is practice, programs, and policies designed to prevent and reduce the incidence and prevalence of alcohol and other drug use and consequent health, behavioral health, and social problems. That's a really big deal to us because that's really where we're coming with our framework with a lot of the great work that's happening. So let's go ahead and do roll call. Wes, do you want to do that, or Ashley? I'm working off my phone today, so if someone could do roll call, that would be great.
Not a problem. I'll run through the list really quickly.
Thanks, Ashley.
Debbie, you're obviously here, so we'll move to
Yes.
Pam. Is Pam here?
Yes.
Thank you. Lindy? Is Lindy here? Okay. Shauna?
Here.
Thank you. Alexis? Amy? Amy Zimmerman? Zeb?
I'm here.
Thank you. Amy Muhlenberg? Luis?
Here.
Thank you. Beth? Dr. Beth Stormshack? Martin?
Here.
Thank you. And Jessica?
Here.
Thank you. Did I miss anybody?
Ashley,
I think Lindy.
Yeah, Lindy.
Lindy. Okay, wonderful. All right, back to you, Debbie.
I'm here.
Got it. Thank you.
Thanks, everyone. I know our Caroline had reached out to Wes and I. She had a conflicting meeting. So let's move on to our director updates from Annalise and Wes, please.
I can kick us off. Hello, everyone. Annalise Dolph. I'm the director at the Alcohol and Drug Policy Commission. Quick updates from other committees in the commission. The Recovery Committee met this month and finalized their definition of a recovery community center. They're doing some really exciting work that Will is actually going to talk a little bit more about at the next full commission meeting. And next month, they're going to be in conversation with OYA, who have developed their own best practices for youth-focused recovery spaces or recovery community centers. So that's some nice cross-agency work. The Health, Safety, and Interventions Committee is still focused on naloxone. They spent this month talking about expired naloxone, which I think is probably going to be of interest to some folks in this group as well. There's a national project called the Naloxone Project that really focuses on facilitating short dated, I think we call it, close to expiration term or post expiration naloxone, which there's some data to show is very effective. So they're working through some things there and distribution pathways, et cetera. And then the commission itself, I'm missing treatment. So treatment is talking about their own provider survey, so a clinical provider survey. So as you all are familiar with, lots of surveys flying around here, something that they might use as a baseline for the clinical treatment system for us to measure progress there on the work that they're doing. And then the full commission met last month and did an exercise really focused on how do we get from these kind of individual progress to prevalence, and what are some of the interim measures and recommendations we might make for state agencies for their funding and programs. That's going to be some longer term work. The commission meets again June 8th. We'll be in person at the Miracles Club in Portland. If anyone wants to join us, those are public meetings. And we will be kind of revisiting this topic of measures a little bit, but doing some membership updates and talking about some data work that we are working on with OHA and the settlement board. So those are all my updates. I'm happy to answer any questions.
Any questions for Annalise?
Annalise, what is the data work that you're working on with the settlement board? Did I catch that correctly?
I will try to give a very quick update on that, Jessica. I would urge you to maybe tune in sometime or tune into the commission meeting when we'll go more in depth. The Opioid Settlement Board is mandated to fund a substance use disorder data system. So they have some funds set aside for that. The work is stalled a little bit. And so we are going to be talking about how we bring together the work of the settlement board, some internal work happening at OHA in terms of their work towards a health data warehouse and our work at the ADPC into one work stream.
Love it. Thanks.
Anyone else? Great. Thank you, Annalise. We really appreciate learning what the other subcommittees are doing and just seeing how our work intersects. I know one of the hats I wear for our county is overdose prevention. And this has probably come up at the treatment meetings, but we've started looking at I think it's Pegasus. I'm not sure if I'm saying that right. And we make sure we get their brand out of the clearinghouse because they do offer free replacement for expired one. So I think that's another new partner. This was not a commercial message, so I apologize if it came out like that. Okay, Wes, do you have any additional updates?
Yeah, fairly quickly, I have a update from Third Horizon. So just on the surveys, we have 35 schools that have completed and 50 in progress. So if that comes to fruition, which probably not going to, but if we had 85 school districts respond to this survey, that would be really, really good response rate. We have three collegiate surveys in from, I believe there's 10, and then we have 9 provider surveys, but the provider survey just went out. I sent out some messaging for all the committee members. Please, 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 if you have a moment, I know big shout out to Pam, who has been doing the Lord's work and spreading the survey across the state. And if you have an opportunity and can share through your networks, we would really appreciate it. Third Horizon provided some messaging for both the school and provider survey. Schools going out fairly soon in the next 2 weeks across the state. So if you can catch an administrator, just remind them, that would be really, really helpful. Providers, we have a little bit more time. Any questions on the HB 3321 work? Yeah, Lindy.
I just had a question about surveys being completed by organizations that have multiple programs and or departments that do primary prevention work. Because in the survey itself, it is a little ambiguous about whether we're recommended to submit 2 responses or combine.
Yeah, we talked about this with Third Horizon, particularly for counties. And so counties should be able to work through the logic and for each department fill out a survey. So we advise, Lindy, even if that's unclear, that you go ahead and suggest to your other departments to go ahead and fill out the survey, and then we'll do some reconciliation on the back end.
Oh, so you are advising to do 2 different ones, like one for each department.
For a county, yeah.
For a county. Okay.
Yeah.
And that I am asking on behalf of a county. So thank you.
I figured so, Lindy. Yeah. No, I feel that, and we recognize that in kind of the early adoption or the early drafts, and so there should be some logic in there. if I'm remembering correctly, but otherwise, I'm just going to tell you, go ahead and do it.
Okay, excellent. Thank you.
Yep.
Hey, thanks everyone. And just since we're a little bit ahead of schedule, I just want to do a shout out. Some of you maybe don't get the opportunity as often to Zoom rub shoulders with the ADPC staff. We mostly see Annalise, Wes, and Ashley, but the work that they're doing behind the scenes, they constantly are really working for us, and I just want to pay tribute to that and acknowledge that at this time. All righty, Wes, let's go ahead and move on to the Oregon Department of Education's Prevention Advisory nomination.
Yes, so we have two nominees for, just to remind folks, the Oregon Department of Education, in response to our comprehensive plan, has developed a community advisory committee to support their prevention work at the department and supporting curriculum, professional development, and policy development at a school level. And to do that, they've developed a community advisory body, which they have opened to a broader community of folks, but they have designated 2 seats for ADPC prevention committee members. Over one of the many pieces of your homework, also shout out to all of you for doing the homework. I so appreciate it. Uh, the was to nominate, and we had 2 candidates who stood out with the most nominations, and the chairs have elected just to move forward with those two nominees. And so Alexis and Dr. Beth will both be representing us at the on the ODE committee. ODE is making final selections, so if you applied through their process, you will know soon if you had applied. But for the actual kind of liaison role between our committee and ODE's new advisory body, it will be Alexis and Beth. And thank you both so much. I see Alexis is here. Thank you so much for agreeing to do that on our behalf. In addition to that, I am going to be helping to staff that with ODE. So we will have multiple ways of making sure that the information that is said there comes back to us, and the information that is said here goes back to ODE. Also, Alana always joins us, so thanks, Alana, for that. And it's been a really great partnership with ODE to design this engagement opportunity.
Thanks, Wes. And this is again, I only know these things because I've been around so long. This is a huge step forward, and if I can call it a win, if that's appropriate. And we are very grateful that Alexis and Beth said yes. I know we had other people nominated, which was really nice seeing that so many of you were willing and had the expertise. I think every single person on this committee could have been a great representative. So it's just great to talks about the quality of people that we have on this committee, and we appreciate the expertise and the willingness again of Alexis and Beth. So we're happy to move forward. And Wes, we really appreciate the work that you've been doing on helping us build this partnership with ODE. And again, we've got the superstar and Alana. So this again is a really big win. So thank you for helping us do with that. Any questions on that process or moving forward from the group? All righty. Well, we are 10 minutes ahead, and I'm not going to blow that. So, big part of our meeting today. And again, as Wes mentioned, thank you to those of you that took the time, provided feedback. Really appreciate that. Maybe you weren't one that provided written feedback, but as we move forward through the scoping for our Center of Excellence, that topic area today, Wes is going to kind of lead us off. This is an opportunity to still provide feedback. And Wes, I'm going to turn it over to you, and Luis and I will be prepared to support you in whichever way you need.
Great. I did want to just mention, because Debbie said that, Debbie alluded to it, and Luis and I had an opportunity to do, I think, 1 or 2 meetings with folks. I just want to remind folks, if this space is not where you feel most comfortable talking out loud, or you need time to process the mass amount of information we throw at you every meeting, we are happy to meet with you outside of this space to get your thoughts on paper. And sometimes it feels a little impersonal to just write something. So if you want to meet, we are happy to do that, to talk through some of this homework with you, and to get your ideas on paper, because it's really, really, really helpful. And we want to make sure that every voice is captured in this document to the extent possible. So we're going to continue to do this process. We'll go through some of the responses today. Some of you commented back onto the audience. Those are fully captured, but I'm not gonna talk a lot about those today, and we'll come back when we get towards the end of the process where we're really starting to button this up and spend some time reflecting on some of those suggested changes. Right now, I want to, given that they're kind of on the margins, there's some reorganization and definitely some things that just needed to be added, some lapses. So I don't think there would be any consensus disagreement, or I guess disagreement, or there would be consensus on those additions. So we'll come back to those, but really I want to concentrate our time on those 5 buckets, 5 tiers of a center of excellence that we kind of scoped out. And there are 2 or 3 that I want us to spend a lot of time on today, because I think there was a little bit more kind of different direction there. So if everybody's ready, they give me a thumbs up and we'll get started. I'll share my screen. Cool. And if I could have Ashley or Annalise just monitor the chat for me and flag me. Um, okay, so you should see the first tier of the scope: resource portal, centralized clearinghouse for evidence-based and community-defined practices. Folks, everybody see that?
Yep.
Big enough text? Okay, perfect. So, we heard a lot from members, and these notes are just as notes came in. So this is fully reflective of what people said, and then the summary tries to capture as much of that in a cohesive way as possible. But I'm just going to high level run through these really quick. But there's need for parent engagement resources, especially for schools. School curriculum. So a really great anecdote. It's hard enough to find social science curriculum on validated supports for social sciences, much less all of the other vendor requests we have to buy certain curriculums every day. So there was some things that work well in education, on the education side. There was some talk about how Washington State Institute of Public Policy organizes evidence-based policy. Blueprints is named here. And then a lot into kind of what is in the actual resource itself, which I honestly, looking through these, not one of these clearinghouses had everything. So I think the overall suggestion is we need an organ-based database. And so there was some suggestion for content of resources to assess which EBPs we would start with and community practices. Tony Biglin sent me some stuff on some thoughts related to kind of how you would assess evidence to come into the system. I think that is a conversation we are like 3 conversations away from, but we might ask Tony to come back and talk a little bit about that. And then making sure, and then there was this question, right? Like, do we need a new clearinghouse, or do we piggyback off of something that exists? And then finally, just defining some key functions. We had a lot of talk on the changes of the to the actual titles of these tiers, I'm totally happy with that. That is just what Third Horizon suggested, and I don't think was meant to be concrete. We are happy to change the titles, and we'll get down on the tiered training one. I think people had a lot of thoughts on that, so we can talk a little bit about that. Overall, this is the summary sentiment for this section as best that I could capture it. What you all would like is a centralized clearinghouse that should have a database or inventory of evidence-based and community-defined practice. This should be new and organ-specific. Practices should be clearly demarcated according to evidence-based, population of interest, behavior, environment of practice, tools, and implementation guides, or at least citations to these, cost-benefit analysis, and literature-backed practice. So the thought was there are systems that you can search via tags for some of these things, and we would have something similar in Oregon with very, very specific kind of web frame documentation for each practice. Portal should include information on who is implementing these practices throughout the state and issues with implementation. So that would be one of the organ-specific pieces to this, because you would be able to find neighbors who are doing similar work and any challenges that they might be having in community. This is one of the staffing callouts that I will name that folks said this needs to be staffed so people can help with not only the search. So what maybe a consultation on what exactly are you looking for? What are you trying to address? But also in support for implementation. And then finally, resources should also include community and parent engagement resources. And I think this was super critical and came up in multiple places. People saw the Center of Excellence as being a key strategic communication hub. So how do we have communications documents that land for different audiences, particularly schools, particularly parents of students at schools, were things that came up. But how can we have resources to support people on why are we doing this? And so I think that was a critical aspect for this section. I'm going to pause and see if people have thoughts based on that commentary. I'm going to open up to members first, and then public, please hold it, and we'll come back to it at the public comment period, since we got a lot to get through. Yeah, Shauna.
Thanks, Wes. This is all really, really thoughtful. Really appreciate you sharing and bringing back comments that have come up from the community. This is something that we've been grappling with at related specific to parenting education with the Oregon Parenting Education Collaborative is how do we maintain essentially a recommended list or an approved list of curricula specific to parenting ed. And we've recently developed or we're working on developing essentially a set of guidelines that will go into our ongoing database that we hold for parenting hubs and partners to use. And some of the challenges that are coming up for us is that some of the long-standing evidence-based programs that are out there haven't been updated in a significant period of time. And as I think about where I'm seeing trainings happening in our local community, let's say through our local behavioral health, through our local sheriff's offices and others, many times folks are putting together information that's as recent as they can get it on specific impacts of new trends and new drugs and new issues that are coming up that didn't exist last month. And so I think there's both a lot of value in knowing what's out there and that there are some long-standing best practices and evidence-based programs around how do we have these conversations, whether it's with families in school settings, with children, and some of that approach that's really been defined through evidence-based practice. And there's new information coming out continually in this space that's so critical for community to have. And so just wanting to put into the space that limiting a clearinghouse to only evidence-based programs, we'd of course want things to be research informed to the degree that research exists, but also making space for promising practices, emerging practices, information that doesn't exist yet in that long-term evidence-based sphere because it is so new.
Okay. So research and evidence-based approaches. So more about the approach like, so if there are things that are emerging or do not have research behind them, but they have their approach or foundational things in them, inherent in them, that would be helpful, that are coming out, and quickly getting that out to both address long-standing substance use issues or long-standing connective issues, or oh, I lost my train. Also having that communication, which we'll get into in a little bit, about emerging substances and emerging practices and things like that.
Yep.
Yep.
And I'm happy to share out some of the things we've been thinking about too, in terms of like things that can be helpful to have in that clearinghouse information around, I mean, year developed. Something as simple as that tells you a lot about the evidence and the research that a program was built on.
I, I
Language
would love for you to send those to me. That'd be awesome.
too. I'll
Yeah.
do that. Thanks, Wes.
Yeah, and I see that Mara put in the chat, and that's what Sean, I'm curious for that terminology of evidence informed. Do you feel like that's a good bridge,
We've
or is it still a little loosey goosey?
evidence informed, research informed. I mean, thinking about culturally responsive, community emergent programs. And I think some of it comes down to the different definitions that you have. And I think you've included this here to some degree too, that some of those tags around just descriptions of in what settings has this been used, in what ways has it been evaluated, in what ways, having that information can be helpful, regardless of the words that are put around labeling that.
Go ahead, Martin.
Oh, sorry, go ahead. Sorry, I can only see my part screen, so I wasn't. Sorry, Martin, go ahead.
No, you're good, Debbie. Go ahead. I'll go after you.
Well, I like what Sean is talking about, because I think that, and maybe I'm jumping ahead, but I think there's going to need to be some type of, I don't know if it's color coding or mapping or something, where maybe someone that's coming from the parenting or early childhood could, see that, maybe this resource, evidence informed practice is, you start it earlier, and maybe that's the connection. And it also might be something that's in, a school setting, but maybe there's some way, and I guess I'm getting in the weeds too much, and I apologize, but I just appreciate Shauna kind of bringing something up, because I could see kind of some way of coding it too, that people can easily say, hey, I'm in early childhood. I want to prevent substance use down the road. I'm not even thinking about this, but look at these protective factors that can do that.
Yeah, that came up in the commentary, Debbie, about population of interest. I think, we could also have a professional tag, like a profession tag or something like that, that it could be searchable by. I'm saying that as not a software developer and saying, oh, this is so easy. But we could try to figure that out with a consultant. Go ahead, Martin.
Yeah. So I just want to add to this conversation. So around, obviously, we want to highlight the data that supports the effectiveness of various programs, and using the quantitative data obviously shows the kind of global impact of said program. But I think it's critically important, especially when you talk about parents and CBOs and things like that, to really showcase that qualitative data, get some anecdotal evidence and some quotes, kind of on the ground, that shows the on the ground impact. That's what really draws people who we can get inundated with numbers, and especially we're all in clinical roles and things like that. But to really show the story or tell the story behind the data, I think is an important message as well.
Thanks, Martin.
Hey, Wes, I just want to quickly comment on the kind of like emerging kind of research and evidence things. So I use the Washington State Institute for Public Policy a lot. And they do have a tab that says current projects, and they talk about what current evidence-based research and projects that they're doing. They have a brief kind of like history where it is and updated kind of research articles and reports. So it's continually being updated. I use the cost benefit analysis when I work with our CCOs to get kind of like backing and funding when I'm trying to implement a certain kind of program. But yeah, that tab is super helpful to know what is currently being researched and kind of where it is now and updated reports. So they're constantly just updating a lot of the different evidence-based programming that they use.
Yeah, that sounds great, Luis, and I love the cost benefit part of that as well.
CCOs love to see that.
Okay. Anything other folks are thinking about what would ultimately be a new Oregon clearinghouse? Because there's one thing I did want to bring up to this commentary about, EBP in general. Like, what EBP are we publishing on the website?
Wes, this is Jessica. I'm not clear of the framing here if you're considering the Oregon Clearinghouse as a new thing, or I was hearing two things. One, needing access to a clearinghouse, but also having a shared kind of place to go to see who's doing what across the state. And I love that latter idea. The clearinghouse, I guess I would be hesitant to do something new, and there are portals out there to do research, and just the amount of time that would take to maintain it. I just feel like it could be a duplication, and just as Shauna mentioned, there are things that are really outdated, and if I guess if we're in a land of infinite amount of resources, like an Oregon database would be lovely, but I suspect we're not, and I would not prioritize that expense over some of the other opportunities that the Center of Excellence has. So I just wanted to, I guess, share that. I'm not sure if you were saying the Oregon Clearinghouse is utilizing existing databases and just, kind of pointing people to those. It's often my experience that my ask or my thought from my community is so specific that it's just really nuanced, and I need to look at something, and maybe that consultation with the staff person could help, kind of think through that. But I'm really excited about the concept of having a list of what my colleagues across the state are using. I think that could be really beneficial, and emphasize that sharing and just collaboration that happens so lovely in Oregon.
I think that's an open question. I think the way I have read these comments is it is something new. Because while there are many clearinghouses, there's nothing that quite captures everything that you all are discussing here today. I do think we have the technology to integrate what you were talking about, like the latter of what you were talking about around the community connection aspect into a database that is supportive of this effort with the advances of both staff with some, not me, a staff person who actually knows what they're doing with respect to inventorying analysis, doing meta-analysis continually, the use of AI in the space. I know Headcoat, for example, in education is doing something very similar for student mental health. So I think it could be something brand new, but I think it is up to this group whether you all piggyback off of something that exists or multiple things that already exist. Go ahead, Lindy.
I think I'm leaning more towards what Jessica was discussing. Of it seems that there are, while maybe outdated, there are a lot of other clearinghouse options, and I don't know that all of them are, some probably have more resources than other, but it does feel like creating something brand new would be a very big investment that maybe we don't need. Like if there is the Washington Athena Forum, there's the PTTC, there's the California Behavioral Health Clearinghouse. Like there are a number of clearinghouses that we currently direct folks to in prevention that I think sometimes people just don't know where to go. Like those need to be vetted. Like which of the clearinghouses do we promote? And yeah, I think as far as the connection to emerging and evolving research, that might be the piece that we need to explore a little bit more, is like, how do we make sure that new and emerging evidence is being just shared with the broader community? But as far as the clearinghouse goes, I think, at least from my perspective, we can make do with what we have at the current state and promote those resources.
Yeah, Pam, go ahead. You're on mute, Pam.
Sorry. When we think about a new clearinghouse, like how are we looking at it? Are we looking at it as starting something from scratch, creating a new one based on other ones that work or function? There was an example somewhere. Maybe it was a different state but like, what are we thinking of? Are we thinking, because I think this is a new thing. So I like the idea of new. Because I mean, currently, do we have anything in Oregon that functions anywhere close to this?
I don't think there is, Pam, just to kind of answer that I know of. I do get the conversation around not creating things. Uh, what I hear sometimes though is that a lot of these programs or information, yes, it's really hard to find. We're always constantly Googling things and finding out through conversations with folks. I also feel that a lot of times people see it being used in another state and they're like, I can't do that here in my community. I can't do this here in my state. Like it's completely different. Funding is different. My community is different. And so that could be a part of training and education piece. But a lot of times that's what I hear is just that it might work well in New Jersey and Pennsylvania, but in Oregon we're a completely different kind of thing. And so yeah, just kind of throwing those thoughts in as well. Sorry, Martin, you had your hand up.
Nope, you said it. I was going to piggyback off what Shauna has said in the chat, which I agree with. There could be kind of a combination where we're kind of listing those other states, clearinghouses as a resource, but certainly coming up with their own, because I think a lot of people, certainly folks that I work with and with different CBOs, we see something from another state and it's like, that doesn't resonate. Like a lot of people won't even click on the link because they're like, well, yeah, but that's California. But yeah, that's Washington State. Even though they're our neighbor, there's still clearly differences across different factors. So I think having a combination at least of some sort would be the way to go.
Pam, did you get your, I want to make sure I circle back and you got your question answered.
Oh, I like I'm trying to understand the concept of new. Like, isn't this new? I mean,
I think it's new in the sense that we're talking about a design that we don't and how it functions that we don't really see anywhere else. Like the things that have been brought up as far as like what's up in Washington or blueprints. Um, those would be great links. But again, if there is this opportunity, like some of the things that Lindy and Luis and Martin and Shauna have said, is to make it more like where if I'm a shopper, I want to go into the store and I know where to find all the different products instead of, oh, I go into a different grocery store and I can't find anything because it's set up different. But I think categorizing it, making it easier for the user and then unique to what's already being, we know that's working or that people are trying in our state. So we can say, hey, Pam, I saw that you're doing this program. How are you doing that? I think I haven't seen that type of, and I'm not sure, or, index glossary, whatever you would call it, where it's set up like that.
okay.
I mean, based on my limited knowledge, I think this is possible. What Shauna and Martin were suggesting, and to Debbie's point of like, there's an API that pulls the information from the clearinghouses, cites the clearinghouse, and then gives you organ specific information on it. I like it doesn't have to be new, quote unquote, to you, but using existing resources in a way that's more efficient. Like efficient, it makes time more time to Luis's point of like Googling specific practices for specific people and then stumbling upon the clearinghouse or having to go each individual clearinghouse to look for something, we could
Right.
pull that information into a centralized place.
Okay. And then I mean, one step further, it'd be great to know who in Oregon's using it.
Okay, any other questions around, and we'll come back to this. So I'll clean this up. I'm going to add this, Alexis, on the sexual assault task force. Um, Okay. I want to get to tier training. This one's there was a lot more agreement here. And so I just want to go through this really quickly if that's possible. Um, there's quite a few name changes. I do not think people were particularly thrilled with MacBo being in the title. I'll just throw that out. And so I think I will just move this, but I think fundamentally everyone agreed that there should be different trainings based on where you are on the spectrum of the quote unquote workforce, or the quote unquote prevention workforce, which we have defined earlier um, in the document. I think one thing that was very clear, I'm just going to go ahead and skip down here for purposes of time. with the lowest tier or most universally approachable need. So let's think something for classroom teachers, needing to be free, virtual or with local options, not super time intensive, particularly oh sorry, I already said that, but really having very low barrier training supports for people who touch prevention, but prevention is not their primary profession. I mean, we would think of them as probably frontline folks, but like they do not they're not coming to meetings like this, I guess is what I'm trying to say, or necessarily meetings where they have primary prevention of substance use in their title or their job description. All the way to having multiple certification and continuing education pathways for targeted workforces. We need to provide flexibility away from the MACBO cert, is what I've seen in these comments. Change the pillar name away from a single entity or a specific profession being the certified prevention specialist, but offering multiple pathways. Training personnel might have to also be supportive of preventionist coaching and leadership development. So the thought of if we had some staff, this would be another staff call out, is providing some mentorship or coaching for preventionists who are out working throughout the state, or empowering organizations like OCPP or ORCPP or others to do that work. So
Yeah, that's what I was thinking,
a
Wes, when you were
matchmaker.
talking, when you were talking about some of those that, again, a lot of this is, to me, it's like we do have some of these pieces in place within our state, but it's like the magnet, unfortunately, we're repelling away from each other instead of like, coming together, like with what ORCP is trying to do. Again, you've got some of the early learning hub. There's some of these frameworks, but I think we need to be able to tell our story somehow that people can see where they fit. The certification, I think, is a tricky one because it's a national certification. So I think MACBO has to. I wouldn't want to walk away because that's already set up, but that just can't be. We need, whether it's this or the ORCP, to be able to help people get to where if they even want that certification. But then I think we have partners, like we're doing in my county, doing a lot of stuff with a partnership to end addiction. And I had no idea the amount of free resources they have available, that people could get that little kind of a dosage of, hey, I can see myself doing upstream prevention. In fact, I'm already doing it, but I didn't understand that. So ways to connect all of the workforces. And that kind of goes to the discussion we were already having, but my dream is that we don't have a million certified prevention specialists, because then the majority of them would be unemployed. But we need to have more people that understand how they can play a role in that, and if they choose to go on further, that's great.
Hey, Mary.
Hi. Um, this is a very timely question for me because I was late to this meeting because I was meeting with the Director of Health and PE for Portland Public Schools, and we were completing the ADPC survey that came through ODE. We
Thanks,
completed
Mary.
it
We
together.
appreciate you.
Sure. Um, you know, Jenny is the administrator over health teachers for PPS. And you know what feedback we gave on the survey, and that I'll share here, is I love the idea of tiered trainings and trainings geared towards teachers, because health teachers are the majority of our workforce doing drug and alcohol prevention in Oregon. And so recognizing that and supporting them to be really effective at that is money well spent. And what Jenny raised is the issue for districts is teachers in Oregon are unionized, so they have to be paid to attend these trainings. And if they're out of the building, then districts need money for substitute teachers. So it is thinking about the costs and feasibility of making those trainings available. So I totally think we should do it, but also keep in mind the larger system that teachers operate in.
It's a great call out. Amy called out something very specific, and I think that's the reason we made it like free, local, online because of the substitute issue, especially out in Eastern Oregon where there are no substitutes, is what I heard from Amy. So we are very clear on that, and thank you for that. Thank you for reminding us. I want to call out also coaches were brought up as a specific workforce. And last meeting, we talked about some of the pre-coach certification trainings that they have to do around first aid, like thinking about what if we included some prevention pieces in that as well. And so really appreciate it, Mary. Are there other big things? I feel like we have a lot of agreement here. So if we can spend a little time on the back end of this, I'd love that. People good? Great. Um, okay, here's another one where I think we got a lot of agreement. So I'm going to read. So if people do not know what the Health Alert Network is, it is a system for emergency response. I think Louise said it and I got COVID flashbacks. But I think what you all should know is that there is an alert system that is built in the state that the state maintains that provides rapid access to information. Generally, it's on communicable disease stuff, but there are other uses of it. And I think what folks were pointing out is having a very attuned listserv that could get out information quickly to partners of the center would be super helpful. And then you could build from there as you build out your network, what that information might be for, an emerging drug or an emerging practice. We talked about emerging practices earlier. Shauna brought up kind of like things that are brand new that are coming out that could be helpful in community. Establishing a system like that could be a centralized piece of the hub. What do folks think about that?
So I just wonder what the implementation of that would look like. Like in my mind, I'm thinking, so there's this, committee of folks. I don't know, we haven't talked about staffing at the COE yet, but I'm thinking like a committee of folks whose task would be when that information needs to be disseminated in a rapid fashion, then they reach out to kind of like the larger regional nonprofits who have a bunch of partnerships, local partnerships, and so, but they inform this, like Alliance for Life, right? We have a ton of community partners. They inform, Gobi or whomever, and then they are responsible for then disseminating that. I'm like, what's the approach for how this could get into all the folks' hands that need to know it.
Yeah, so I know a little bit of how Han works, and that is done through a joint kind of work through an epidemiologist identifying something, and then a communication strategist working together to get information out to people quickly. I think right in times of emergency, communication is key. So helping people to understand why and why it's important, I think, are the two things that would be required. Who would do that is a harder question, Martin. If we're starting to stack all these people that would be working for the center, we're getting up there. So I think this might be something that we would need to work towards, but I think at the very least, establishing a channel of communication for high alerts. And so when you know that you're signing up for a listserv that is specific to emerging needs within substance use, you know that you are going to get an email about something, I think would be the kind of the first step. And then you would gradually get to a place where potentially you have someone with a science background, which you would assume would be part of the staffing model for this, whether that's their full-time role or not, helping to make key decisions on what should go out to community with the help of a communication strategist. I'm sorry, Luis, I didn't mean to cut you off.
No, it's fine. I will let Dr. Lynch go first, and then I'll follow.
Oh, thank you. Yeah, so I'm very familiar with the HAN, and I think this is a great idea. We see this in public health, emergency preparedness for most counties are connected in with this, which is mostly connected with sheriffs in individual counties. They have a wonderful resource already built into it for CCOs and partners that get these HAN alerts. For myself, I would share this with our behavioral health team that's on staff. Mobile response units are all linked in. So I think using this in a way that either if there was a PIO on staff with a science background that would be directly in contact with the OHA epidemiologist group, they would just throw that their way, let them send it out, and use all those connections that are already built. So that would be a wonderful opportunity to move that quickly through our community. So I support it.
Thanks, Dr. Lynch. Yeah, just to kind of give some more context of the HAN, I received all of them during my time of COVID and the emergency response that we did here in Lane County. I still receive them. But we get them for not just emergency diseases, so like measles, any kind of STI things that are happening. We also get them for wildfire. We get them for other kind of statewide emergencies. They give you an update of where things are kind of concentrated to let other folks across the state know what the response is at the state level and some ideas for if it is a communicable disease, ways for treatment for providers as well too, and local folks at a county level like myself could like implement right away to kind of mitigate a lot of the risks that are coming or that the state is seeing. They are I love the framework of the emergency response and how they go about communicating it to partners all across the state. It's a super effective communication tool. And if you haven't signed up, I kind of recommend you sign up through the Oregon Department of the Emergency Response because you will get updates on like wildfire, which is coming up here. And it'll let you know specific areas and things outside of our prevention work.
Yeah. Thanks, Luis. Holland's going to have a huge uptick in signups today, and they're going to wonder, and I'll just send a note to my colleagues over in disaster preparedness and let them know it was us. Any other questions around Agile TTA dissemination? Okay. I am going to do policy translation conduit to translate field insight into ADPC policy recs. An academic translation, partnering with research institutions to advance translational science in one thing, because I heard a couple of comments around why are we separating these two categories when they could be done more efficiently and supporting both the policy and practice aspect of translating academic literature. You should go ahead and translate it for the policy audience who might need to do that work or think about that role for the center. So the first big piece was on the policy. The COE has capacity for policy tracking, review, documentation of evaluation of that policy, if there is any, policy to practice implementation guides, integration of tribal-based practice into policy, integration of culturally grounded practice, and technical assistance in policy development. And then there was this comment of needing to tie that to academic translation. So thinking about policy is the same as thinking about translating academic work to practice. So the summary of the sentiment is we feel like we need to discuss this further as a group, would suggest thinking about how the clearinghouse could tie to academics in Oregon and other institutions studying specific practices. So this could be another tag, right? If it's being studied by U of O, someone at U of O, or being studied by someone here in Oregon, generally I will say my experience with the academic community in Oregon is if you have a question, they are very happy to answer it, being in your backyard. But I think we need to think about this section a little bit more. Also, I will just say a lot of the policy evaluation that's done in the state happens at academic institutions. So there is not a robust think tank group that's out in the community who's like that. If you think of the Washington State Institute of Public Policy, like think about more generalized. I know in the East Coast there are independent nonprofits that are doing kind of like policy analysis a lot. We don't have that a huge field of that in Oregon. And so thinking about that, that's going to bleed into the academic translation as well. Just wanted to note that. Any thoughts? I gave you 2 more minutes, and then I do think we need to talk about local coordination before we finish. If this is not your jam today, I can draft something and send it to you all, and you can think about it as part of the homework. Okay, Dr. Lynch, thank you for saving me.
We were sinking there for a second, so I thought I'd just jump in. What if our Center of Excellence had a affiliate faculty member on some of these universities, like OHSU, PSU, School of Public Health, or something else? And that would bring that connection together and maybe open up opportunities to speak at these universities, as well as have some of the students do some work that we want to look at across Oregon and across our regions. I know I can only speak as a recent affiliate faculty for OHSU and PSU, and I've been up there meeting with a lot of the faculty and deans and students, and they are very willing and able to jump in and help our community where there are some gaps.
Any other commentary? Good comments, John. I will add that. Sean, I got you too. Okay. Think about this. I will clean up and add some language. This next document will have the full notes. We'll have two. So we'll have this document where it's capturing everything. And then I'm going to start to clean this up a little bit. And so I'll have a clean version, quote unquote, that we'll be working off for next time. So just keep that in mind. Let's get down to local coordination and building. Oh, I do want to bring up something that I think gets to uh, kind of what we prioritize in bringing the evidence space. Thank you, Pam. Pam did a lot of homework, but including on top of all the outreach she's done. She suggested a sixth pillar, which is like thinking about kind of what is the evidence that we're going to start with in terms of putting into the center itself. But it's just this integration of risk and protective factor system. And so really a role is to think about some of this work that's happening for risk and protective factors and integrating that into the system fully for a full system of support. So since this is brand new to y'all, I want y'all to read it, really digest it with the homework and come back to it. I do want to get to this local coordination bit because I do think it's really important for everybody in the room. And there was a lot of commentary on it. So here is the summary of what I got. Just like everything in Oregon, it's not a one size fits all. So I think in higher resource communities or in communities where there is established prevention leadership, COE is really a background tool to support further partner development and empower leaders to continue towards a unified approach in their own communities, implementation of best practice, and broader workforce development. We also heard from communities that don't feel like they have that leadership. And so, or it's very fragmented. The COE can act as a bridge and a facilitator. And so it's not necessarily we're here, or not we're, because it would be the COE coming in and say, we're here to save the world. It's really, I know that you are funded to do this across all 5 of these sectors. How can we bring everybody to the table? And then to develop leaders through that table so that the center can leave or not leave, but, be there in the background while folks create. The center could offer regional cohorts and gatherings to support local coordination and partnership. This also gets to the tiered training, so professional support, but really thinking about how can we learn from each other regionally and host tables regionally across different counties or different regions, CCO regions, things like that. Work with systems of care to do something similar and think through that. Need to think about cross systems alignment with governments. So gets back to this kind of conversation of like really, really fragmented communities where, maybe the county agencies don't all get along, or maybe the school and the county don't get along, or like there are times when this happens. It's natural. But, I mean, we all work a lot of us work in government, we know. And so like, how do we have some translation across all of these government entities so people know what are the resources that are available? The HB 3321 assessment is the first time we've tried to do that as a state, and maybe that could be replicated at a county level. This could be critical. This could be a critical role of the local coordination. And then this strategic communication piece came up big time. So I think it's one thing to have the leadership already in your community, to have the resources to do communication with that leadership, to expand across communities and to make those connections. I think folks would love support with that. Was what I've heard and what we've seen in the comments. So I'm just going to leave that there, and I'm going to leave that there, and I would like us to spend the last 10 minutes talking about that. Yeah, Martin.
I know this was brought up a couple, 2, 3 meetings ago, but I think as part of this effort to kind of, get folks to the table at the same time, either hosting the COE, either hosting an annual conference to bring folks from around the state together to, talk about who's doing what and how things are going, and do workshops and all that good stuff. But then, and or for there to be regional kind of summits, maybe semi-annually or whatever the case, just a way to convene folks either by region or a statewide conference. But to be able to come together, people always get the most out of kind of these in-person, convenings, and so I think that should certainly be a part of this effort.
Thank you, Martin. Yep, that did come up a couple times. Appreciate that. Okay, Shauna. Shauna, love the inclusion of cross-sector prevention language, as well as cross-system alignment here. Developing accessible, shareable cross-sector language resources and research speaks to what Debbie noted earlier about wanting everyone to understand how they fit into the system of prevention care. So often barriers arise because individuals and organizations may not understand or be able to justify how related initiatives fit together. I love that. Well, that is I love how you said that. Building those bridges can help communities and organizations better leverage resources and opportunities for stronger collaboration. Pam.
One of the first when I read this, it makes me think of when I got the DFC grant, and they spend quite a bit of time explaining to, I would say, oh, I'm doing prevention work, but I didn't understand the infrastructure and how it all worked together. And so when I read this, that's kind of what I'm picturing. It's like if there is a part of the COE that is sharing with someone, this is, in theory, this is what you're going to try to aim for. And this is how I don't know, the sectors work together, how you collaborate, how to get into schools, how schools find information. But there is information that could be shared, because not everyone's going to have a DFC grant. But there are resources, training, et cetera, that could help people bridge all of these things that information is out there.
Thanks, Pam. Amy, I also, I'm sorry to put you on the spot again. I keep calling you. You just provided us with such great information. I think the other thing that I wanted to highlight in this is our border communities in which the nearest population center is not in Oregon. And so I think it is really important. This would be a really important local coordination role for cross-jurisdictional issues, where a school or another community-based organization, their nearest prevention support, so to speak, is in Idaho or it is in Washington. And so I just wanted to call that out as something that we are keeping in mind for this part of the scope. Pam, did you have another comment? Or okay, you're good. Anyone else? Yeah, Jessica.
I just wanted to briefly add a new concept to the comment, which I love, that says center could offer regional cohorts and gatherings. I would like an and maybe there to just acknowledge that some communities might not be similar to their region. So Deschutes, Jefferson, and Crook County are good examples. We partner really well together, and each county has such a different culture. So sometimes it really benefits Deschutes County to communicate with Clackamas and Jackson County, where we have similar sizes and so forth. So I I don't want to discourage the regionality because I think that's really important. Just wanted an and to consider kind of hosting and fostering other collaborations.
Yeah, so cohorts based on approach or size, population size, other ways to organize based on commonality of some sort. Yeah, thank you. Pam.
I think would also be important to list that there are counties that have that, like the Clackamas County Prevention Coalition that exists today. So, should that exist in other places in Oregon, they could be helpful to other communities that are like, how'd you start it? How are you? What does it look like? But I think it would be important to list the ones that do have it.
I love that. The one thing that we didn't name necessarily, at least I don't remember, and that it's a central role for us at ADPC. So maybe selfishly, I'm going to put this in here as a comment from ADPC, but empowering the LADPCs as well, and kind of staffing wise and support as much as possible, and making those connections where they don't exist with our prevention partners, would be really important to us, given our statute. Just put this in here.
Hey Wes, I love how you mentioned the local ADPCs. I feel like they sometimes need support and guidance and facilitation and ultimate goals and partnerships, because it's just not always happening. So I'm glad that hopefully you put it in there.
It's in here. Yeah, thanks, Luis. I appreciate it. All right, I'm gonna get a real quick temperature check to see if we're feeling good where we're at as a committee, because I'm feeling great. We are well on our way. We are on schedule. We have a couple more scoping questions that I want to ask in the homework, and we'll go through a similar exercise. I will put this in kind of a way that is more easily digestible than a lot of my misspelled notes and pulls from other people's notes, and make it available to you all a week from today, by a week from today. So you have a few weeks to read it and digest it and offer feedback. The homework questions that I will ask you will relate to this thought of what the focus. So we have a focus on primary prevention explicitly. Where do we draw the line with other systems? And how do we support those other systems? I think Pam's integration of risk and protective factors is a good place to start with that conversation. So I will include that as something that I want you all to comment on. And then we will go from there. I'll meet with the chairs. We'll discuss the conversation for next month. We will also have an update from the Third Horizon team. So I just wanted to name that. We won't have as much discussion time, so I might really rely on you all to do the homework as much as possible so we can keep moving forward. And then in July, I'm hoping we can move to governance.
Any other questions from anybody? I think kind of the full scope or the kind of cadence that Wes just mentioned. I think it is pretty exciting from, I think it'll be really fun, once we really get this all wrapped up down the road. But I think about Dr. Tony Bigland, this has been a dream of his, and just where it's at right now compared to where we were when it was just kind of a dream 6 months ago. And Wes, I think, really doing a great job of helping us go through this process And it's starting to have a great foundation. So please continue to share, whether it's here or, as Wes said, reaching out to him or Luis and I, or writing. That's what's really giving us the meat and the bones, and everybody's perspective is extremely valuable. We do have, I think on our agenda here, we're moving towards public comment. I know we do have some members of the public. If you want to share something in the chat or come off mic. Looking through. Ashley, do you see anything in the chat as far as someone wanting to share?
No, and I did not receive any written comment.
Okay, I don't see anything either. Thanks for chipping in, Jill. Great collaboration work, everyone, from one of our big prevention partners in the world of pediatrics. I will give this a little bit more time in case we have anybody. I want to make sure I mention not seeing any hands. Okay. I think we're in a great place, Wes.
We do
And if
have one.
Wes isn't
We have
happy,
one public
nobody's
comment.
happy.
We have
Oh,
one-
awesome.
Sorry, I got one a private message. So ODE just Alana had to leave a little early, but wanted us to read this in public comment. One opportunity or consideration for the Oregon-based clearinghouse is a tag that there is support for alignment with the Oregon Health Education Standards. So there has been some analysis done that maps them, is super helpful for schools in particular to sell that to their communities. So I'm just going to add that as a comment if everybody's okay with that into the document.
Yeah, and I know we've had some of our, it was brought up, I think it was John, if I remember correctly, brought up earlier, the research, prevention scientists, researchers. I know I've had a couple offline conversations with a few of those, and they have said, hey, we want to help. So that I think getting that connection too with the schools. And again, just the fact, Alana, I know you had to leave, but and Wes, the fact that they're saying, hey, we want to see that is a huge win. Pam.
Piggybacking off that, I attended a webinar that was hosted by NIH and NIDA, and I reached out to Dr. Goldstein, who's the chief of the prevention research branch at NIH, and shared with her what we're doing here in Oregon. And one of the things that she was instrumental in bringing to life was the blueprint report, which we have the University of Oregon person, and then Lisa Saldana with Lighthouse. But this researcher reached back out and said, I'd love to know what you guys are doing. And so we're going to schedule, Debbie and I are going to meet with her, because I was thinking about the policy translation, the academic translation, stuff like that. Because she's like, well done, Oregon. I'd love to see how we can help you. So more to come on that.
Thanks for sharing that, Pam. We're on the Oregon Trail with Trailblazers, to pun you out as we close out the meeting. Unless we have anything else, I think we'll close up and look forward to seeing you on that last Wednesday in June with some great updates from Third Horizon on the behind the scenes work that we've heard, rumblings and good and bad. So we'll just be open-minded to hear what it is. And again, all of our information is good information because it's helping us move forward in a direction. And there's no shame or blame. It's all about how we move forward. So thank you for the role that each of you play as committee members, as well as the public that takes the time to join us. I brag at our big committee meetings, commission meetings, that I have the best group, and there's nothing that's changing that. So thank you, everyone, and we'll see you next month.
Thanks, everyone.